right, new year, new you. But are you willing to go under the knife to get an updated look?
All right, so we have Dr. Edward Lee, board-certified plastic surgeon at Nuveau Plastic Surgery, here with us this morning. Good morning. Thanks for being here with us.
Thanks for having me here.
Why is this time of year, I guess my mind could wonder, why is this time of year so popular when it comes to plastic surgery?
So this is the busiest time of the year for plastic surgery for a number of reasons. Number one, people have time off for recovery. So without having to take any extra time off, PTOs, we have time for recovery. Two, people have holiday parties to attend. They want to look and feel their best. So for non-surgical options such as neuromodulators and fillers, this is a great time to get that done, look and feel your best. Three, it's cooler outside, so people tend to stay indoors. And so you tend to recover better in that situation without the sun exposure. And then if you're going through insurance, sometimes patients, when they take deductibles, some surgeries that are covered by insurance can be a reasonable approach to plastic surgery.
Okay, so let's talk about some of the top 5 plastic surgery trends for 2023.
Sure, so this year was a year of those miracle weight loss drugs, such as semaglutide, tirzepatide, better known as Ozempic, or Wegovy, Manjaro. So we see a lot of patients who have lost transformative weight loss. And so with that said, there's a lot of extra skin that we have to address. So like we saw with the first wave of weight loss surgeries, we're seeing a lot of patients getting weight loss surgeries done, nip tuck, tummy tucks and such. And so number one. Number two is that whereas in the past few years it's been bigger is better approach, looking at more patients wanting to look slimmer and fitter. And so whereas BBLs are really popular, and still are popular, we're seeing patients opting to do more contouring, such as liposuction, high definition liposuction, etching, and contouring. Three, we're seeing patients also wanting to downsize their implants, along with the same, BBLs and larger implants were the thing a few years ago and even last year, but this year, there's patients wanting to look fitter, and so we see patients opting to do that. Four, we're always going to see uptrend in patients getting non-surgical treatments such as neuromodulators, fillers, lasers, and energy-based devices for body contouring. They work great. With that said, though, the fifth trend is that some of the patients are fatigued by having years of done this, so now want more permanent results, especially in the facial rejuvenation area. So we're seeing patients opting to do like facelifts, eyelid surgeries, and brow lifts in lieu of getting Botox and fillers.
So I know we talked about, before we came on here, obviously you said BBLs. What are we expecting going into 2024? Any new trends or essentially the same?
I'm nervous
Right.
to hear what's coming up.
BBL is still a thing, it works, but we're seeing patients who want small improvement in, let's just say hip dip, for example. They don't like the contour irregularity, as opposed to looking the biggest they can. And so that's going to continue to be a trend in 2024.
Okay, well, so real quick, what do people need to know if they're going under the knife for the first time?
I think talking to your surgeon about expectations and what you want out of the surgery. It could be scary to go under the knife, obviously, right? But just knowing what you're getting into, getting informed consent, and having a good recovery protocol, I think is very important. And communication, obviously, right? And so I think that's the biggest thing.
All right, good info. Thank you so much. Again, Dr. Edward Lee joining us. We appreciate it.
Thank you so much for your time.